Hi, I'm Hannah Norton, a Reference and Liaison Librarian at the University of Florida Health Science Center Libraries. This video discusses helping your patients find and identify good health information online. We'll talk about some specific recommended health information resources that are targeted towards patients and their families, how to evaluate health websites, and where to go for more help on this topic. First of all, what do we mean by consumer health information? Consumer health information is what patients seek out for themselves, as compared with patient education, which is information given to patients by healthcare professionals while those patients are at the hospital or clinic. So why should healthcare providers care about consumer health resources on the web? Well, for 3 reasons. It's the patient's right. The Association of American Physicians and Surgeons includes in their Patient's Bill of Rights the right to be informed about their medical condition, the risks and benefits of treatment, and appropriate alternatives. Health information resources designed to be understood by the layperson are essential to this. It leads to better health outcomes. Patients who are active in their health care, including confidence in finding health information, show improved self-management behaviors such as exercise, healthy diet, and medication adherence. Why the internet? A 2013 survey found that 35% of U.S. adults have gone online to diagnose themselves, and a third of these people don't consult with a medical professional to confirm their diagnosis. Even more, 59%, said they had looked for any health information online in the last year. Now that you have a sense of why consumer health information is important to healthcare providers, let's look at a few recommended websites. MEDLINE Plus is our top recommendation as a starting place for any consumer health information need. Created by the National Library of Medicine, it is especially useful for patients with limited health literacy or those beginning to gather information on a disease or condition. The bulk of MEDLINE Plus's content is in its health topics, covering over 975 diseases, health conditions, and wellness issues. It also contains information on drugs, prescription and over-the-counter, herbs, and supplements, searchable by brand name or generic. Easy-to-read materials, a medical encyclopedia, videos, and other tools are also available. MEDLINE Plus health topics are hubs of information with links to the appropriate NIH Institute and other reputable healthcare organizations, such as the Mayo Clinic. Unlike well-known websites like WebMD, MEDLINE Plus contains no advertisements or product endorsements anywhere on its site. FloridaHealthfinder.gov is designed by the Florida Healthcare Administration for the public in our state. Information on hospitals in the state includes their annual number of visits, average length of stay for patients, readmission rate, and current charges for 150 common procedures. Other information available through the comparison tool includes number of procedures conducted per physician, quality ratings for nursing homes, and prices for the 150 most commonly used prescription drugs. The site also covers Medicaid and other insurance options, features a symptom navigator, which suggests when to self-treat and when to contact a medical professional, and houses a locator tool designed to give directions to healthcare facilities as well as information on payment types accepted and languages spoken at those facilities. Clinical trials that result from NIH funding must be registered in clinicaltrials.gov. It also contains some information about results of these trials, even if they aren't published in the literature. This is useful to patients who are interested in enrolling in a clinical trial. The clinicaltrials.gov website has a section dedicated to patients and families, which explains how to search for a trial by health condition and geographic area, but also it contains background information on what clinical trials are, why they are conducted, and how they can participate. Pill identifiers help patients recognize medications by their look. Both PillBox from the National Library of Medicine and Drugs.com's pill identifier allow for searching by physical characteristics of the pill. What happens if a patient comes into your office and says that they need a specific pill or treatment because such and such website said so? Well, if you're a good provider, you will listen to your patient and not dismiss them out of hand. But how can you tell if the information they found is trustworthy? We'll discuss that over the next few minutes. You can also help teach your patients how to evaluate health information themselves. The Health on the Net Foundation certifies websites as having reliable health information and representing it ethically with their HAN code. The principles listed here make up the criteria for the HAN code certification. Good health websites will have qualified authors who disclose any financial conflicts of interest they may have, clearly state where they get their information, and justify health claims, not compromise visitors' privacy, provide up-to-date contact information, label advertisements, and always clarify that patients should consult with their healthcare provider for diagnosis and treatment. We can compare these two websites on lactose intolerance. The site on the left is from the NIH's National Institute of Diabetes and Digestive and Kidney Diseases, or NIDDK, and contains plain language information about lactose and lactose intolerance. We can see a clear link on the top to about the NIDDK, so we could find out more about what this institute does. While the site isn't exactly exciting, it also doesn't have extraneous information distracting us from the main content. On the other hand, the site on the left is by Chris Kresser. When you follow the About link at the top, you find out that he is not a medical doctor, yet he is claiming to have a cure for lactose intolerance. The right-hand side of the site is made up of advertisements, including to Chris Kresser's own products. The basic content does have references, but we can't tell where they go. When you're on the page, you get even more pop-up ads while reading this content. WebMD is the best example of a health information website that maybe is reputable. WebMD does have reasonable content and clear information about their editorial staff, privacy policy, terms and conditions of use. The main problem is that its health stories are difficult to distinguish from a plethora of advertisements that have a similar look. So here are some more specific things to look for, not related to the medical content of the site, because patients aren't necessarily going to know whether or not it's correct, but on the layout of the site and information about its parent organization or author. First, check the URL. .gov or .org sites are often more reputable than .coms. Take a look at the About page and any editorial, copyright, or privacy policies listed. These are typically found at the header or footer of the website and can give you an idea of potential biases or credentials. Similarly, transparency about where the website's parent organization is and how to contact them is important. Look for physical and email addresses, phone numbers, and even listed office hours. A common important disclaimer for health information is that it should be considered in consultation with your healthcare provider and doesn't replace professional medical advice. Acknowledgements or citations will provide more detail about where the information on the site comes from. We've already discussed advertisements a fair bit. If present, they should be clearly marked. An online store or list of sponsors may indicate a potential conflict of interest, or the fact that the primary purpose of the site is commerce, not information. Finally, check out when the site was last updated. Current information is often very important in making health decisions. As always, please feel free to contact the library if you have any questions. Our consumer health librarian, Maggie Ansell, can help you get started with helping patients navigate health information. You can also get in touch with your liaison librarian, listed by class on our liaisons page. For more materials on information resources of all varieties, see our guide, UF Information Resources for Medical Students. It does have a tab on consumer health information. For even more information specifically on consumer health, check out Maggie's Consumer Health Guide.